Dr. Sit and Ashley, welcome to Inside South Florida.
Good morning. Thank you for having us.
Thank you for having us.
Of course. Excited to have you ladies on. Tell us, how does breast density influence breast cancer risk and complicate early detection through standard mammograms?
With dense breasts, first I want to make sure that a lot of patients understand that are watching, this is not an abnormality. 50% of women do have dense breasts. The issue with dense breasts is it makes it a little bit more challenging for the radiologist to interpret the images. Women who have dense breasts have a more white appearance on mammograms, and that way it makes it a little bit more difficult because so do elements that are consistent with cancer, like tumors and like calcifications. Those also appear the same white on imaging. Additionally, many women who have dense breasts will have the cancers will develop in the fibrous or the glandular portion of the breast, which is what most women with dense breasts have more of. So it just makes it kind of obscures any of the cancer findings. So it makes it a little bit more challenging. The tool that I personally choose to use, and many doctors also and providers choose to use, is the MyRisk Hereditary Cancer Test with RiskScore. This is the first test that was created and the only current test that has actually been clinically validated for women of all ancestries. Most genetic testing done in the world is done on women of European ancestry. So Black women, Hispanic women, Asian women, Native peoples may not have the same access and the same assessment. And so this is a way for all women to have fair and equitable information so that they can act upon it if it's indicated.
Ashley, let's talk about your personal experience with genetic testing. Why did you choose to undergo genetic testing, and how has it impacted your cancer prevention journey?
Great question. Genetic testing was that pivotal moment in my life, helping me to understand my personal risk for breast cancer as well as other cancers. I also had very dense breast tissue. I have a family history on my mother's side with 3 or multiple breast cancers. My mother had metastatic breast cancer. My father is a prostate cancer survivor, and the myriad MyRisk provided insight beyond what I could see, beyond what I could feel. That information was overwhelming at first, but the knowledge and power really informed my decisions. It really created a pathway or roadmap that really helped me to navigate and protect my health. So that was early initiation to screening, that was making lifestyle changes, that was also having to make the decision to have a preventative double mastectomy at the age of 31.
We know that genetic testing is important for early detection. Is there any guidance from an OBGYN physician on how to interpret and act upon genetic testing results for breast cancer risk?
Oh, yes, absolutely. This is something that you need to have a conversation with your provider. There are different, there are different findings. Certainly you can be somebody like Ashley that has a known mutation, but just because you're negative with a strong family history, you're not the same as somebody who has no family history. So that's where, there needs to be a little bit more nuance to conversation about, lifestyle strategies to mitigate your risk, even medications, even surveillance. There's lots of other things that need to be done. So it's so important. And that's why the MyRisk Hereditary Cancer Test with RiskScore is, in my opinion, superior to many other tests because it allows you to nuance that extra middle group of patients.
For more information on all of this and more, where can we go?
I encourage every patient to go to getmyrisk.com. It provides you to get an opportunity to get that information and partner with your physician to make changes if it's indicated.
Awesome. Dr. Sit and Ashley, thanks so much for hopping on to ISF.
Thank you so much for having us. Have a great day.